The practice here is basically a rural practice. We do general ophthalmology. We see a little bit of everything. We do a lot of routine refractions, but we also see farm injuries. We see a lot of elderly folks who have cataracts and glaucoma, and basically just do a little bit of everything. Well, I believe we've had the machine less than a year now, and most of the procedures that I do are primarily glaucoma. Probably, well, almost everybody has been on medication first. It's unusual to do, for this practice, to do it as a primary procedure with a new diagnosis of glaucoma. So in general, it's used in addition to medications. Certainly there are some patients who can't use medications or don't use them well, in which case we very rapidly would go to doing something like an SLT. But the majority of them are, the procedures are for patients who either haven't responded well enough to medications or are progressing despite medication.
So we have a comprehensive ophthalmology practice. We have a lot of glaucoma patients here as well. And so with this duet laser, we do approximately on a per month basis about 50 SLTs a month and approximately 40 to 50 YAG laser capsulotomies and maybe 5 to 10 YAG laser peripheral iridotomies.
Practice has been around for about 25 years now, and it's mainly half of it's a general practice and the other half is corneal and refractive surgery. And we do the SLT procedure probably in about 20 to 25 procedures a month. And we do probably about twice as many YAG procedures a month, so anywhere from 40 to 50 per month. Primarily we use it as a sort of a second line treatment. When somebody's on one glaucoma medication, then, and if we need to add a second glaucoma medication, we'll consider doing the SLT instead. So we primarily use it for that purpose. Now, I am getting a little bit more aggressive with the treatment, and even when patients come in for the first time, and rather than starting them on a medication, we may suggest to start them directly with SLT. Now, repeat SLTs are a little bit more infrequent in my hands. I would say maybe about 5% of treatments we actually go back. Typically, SLT will last about 5 years, and then we might have to go back and do a retreatment. So that's about 5% in my practice.
We're a basic comprehensive ophthalmology practice. We perform approximately 20 to 25 SLTs per month, 25 to 30 capsulotomies per month, approximately 5 iridotomies, and approximately 10 retinal treatments per month.
Well, we're a comprehensive practice. We have 3 office locations in Naperville, Illinois, Elmhurst, Illinois, and Oak Park, Illinois. Our age range of patients ranges from children to adults, so we see anybody from newborns up into people well into their 90s. As far as the laser procedure and services that we offer, we cover the gamut, and we do about 100 to 120 laser procedures in total a month. Although I'd say the SLT laser is probably about 15 to 20 per month. I'd say between primary and adjunct versus replacement therapy, it's about half and half. So I'd say about 50% for primary and 50% for either adjunct or replacement therapy.
Well, I'm a general ophthalmologist, and I perform a number of lasers, including all the ones you mentioned. Currently, I'm performing about 4 to 5 SLTs a week, as well as about 4 to 5 YAGs, and then a scattering of iridotomies and retina procedures, including focal grids and PRPs, as well as laser retinopexies. Well, I'm offering the SLT as a primary therapy, and I'm finding that about 25% of the SLTs that I'm doing are now primary therapies, as opposed to starting a prostaglandin analog. I do about 25% adjunct and about 50% replacement if the patient's on one medication.